Let's talk about a blood test you might have heard of, the Cea test. It's pretty common, but what it actually tells us can be a little confusing. We're going to break down what this Carcinoembryonic Antigen is, what the test looks for, and most importantly, what the results could mean for you. So, maybe you're watching this because your doctor just ordered one, or maybe you saw it on your lab results and got curious. Whatever the reason, you're in exactly the right place to get some clear answers. All right, so first things first. What exactly is this test even looking for in your blood? At its core, the Cea test is just measuring the level of a certain protein in your blood. Scientists call this a biomarker, which is just a fancy way of saying it's a signal, something that can give us a clue about what's going on inside your body. Yeah, the easiest way to picture it is like a little flag in your bloodstream. If the level of this protein is higher than normal, it raises that flag. It tells doctors, hey, something over here might be worth a closer look. It's not a diagnosis itself, but it's a really important clue. So, how do we find out what your levels are? Let's follow what happens to your blood sample, from the moment it leaves your arm to when it gets to the lab. It all starts with a simple, standard blood draw, but then it gets interesting. The sample is separated and then kept cool, specifically between 2 and 8 degrees Celsius. And you might wonder, why so specific? Well, that temperature is absolutely crucial to keep that protein stable, making sure the lab gets a perfect snapshot of what's really going on in your system.
Okay, now for the part everybody really wants to know. The results are in. What do those numbers actually mean?
Well, here's the first surprise for many people. Normal isn't the same for everyone. For someone who doesn't smoke, a normal Cea level is considered anything under 3. But for smokers, that baseline is a bit higher. Their normal is anything under 5. And this is so important. It's exactly why your doctor needs to know your whole health picture. The very same number on a lab report could be totally fine for a smoker, but it could be a red flag for a non-smoker. See? Context is everything here. All right, so let's say your level comes back higher than those normal ranges. What could be going on? Now, a high level can be a sign of certain cancers, like colon or pancreatic cancer. But, and this is a huge but, it can also be raised by things that aren't cancer at all, like hepatitis. So a high number is just a signal to investigate further. It is not a final answer. I really want you to pay attention to the careful wording here. May indicate. This isn't an accident. This test is a clue, a piece of the puzzle, not the whole picture. It's designed to start a conversation with your doctor, not end it. Which brings us to a really critical question. Is that number on the lab report the whole story? The short answer? Not even close. It turns out, it's not just about your health conditions. Other things can actually change the Cea number that shows up on your results. Yeah, certain medications and treatments, especially things like anti-cancer drugs and chemotherapy, can directly cause your Cea levels to go up or down. This is vital information that your doctor needs to have when they're looking at your results. So, if there's one thing you take away from all this, let it be this. A test result is just one piece of data. It needs an expert to put it into context. You have to talk everything through with your doctor, your results, your history, any and all medications you're on. They're the only one who can put all those pieces together correctly. So in the end, is the Cea test some magic marker that tells all? Or is it just one helpful tool that's part of a much bigger picture? I think you know the answer. It's a powerful clue, for sure, but its real value comes when it's seen as just one part of your complete health story.